Good morning, everybody. My thanks to Karen and Professor Davis for the warm welcome. It's a pleasure to be here. I'd like to thank Karen and the All-Ireland Institute of Hospice and Palliative Care for their kind invitation to this year's symposium. I'm delighted to have the honour of joining with Maurice to open today's programme. Just to introduce myself, my name is Gerard Cassidy. I'm the Director of Primary Care in the Department of Health in Northern Ireland. The key areas that fall to me include general medical services, the GMS contract, primary care MDTs and palliative care for adults. The theme of this year's symposium, building collaboration between clinical and academic settings, reinforces the importance of bringing together the knowledge, experience and expertise that exists within both of our clinical systems and in academia to inform the development of palliative care policy, practice and education. I know this is vitally important to all of you. High-quality palliative care is underpinned by high-quality research, and the Palliative Care Research Network plays an essential role in this. In Northern Ireland, we're fortunate to have exceptional researchers and a proven track record in research that over many years has been critical to improving our health and social care services. This research has provided the evidence base upon which it has been possible to identify and establish best practice and to benchmark against. In turn, this has helped us to design and deliver more effective and improved treatment, care and support for our population. The context and need for palliative care research is all too apparent. The island of Ireland has an ageing population. In Northern Ireland, population projections published earlier this year by NISRA indicated that the population aged 65 and over is projected to increase by 50.5% by mid-2045, with almost 1 in 4 people in Northern Ireland being aged 65 or over by that year. The number of deaths in Northern Ireland is projected to increase by 32% between mid-2020 and mid-2045, rising from 16,000 to 22,000. So you can hear me okay? No. Yeah? No? Very low? Well, okay. How's that? Better? I'll stand closer? Yeah. Good. But behind those statistics lies the reality that more of us will approach the end of our lives with chronic and complex conditions. The direction of travel is clear. There is and will continue to be an increasing need for palliative care. The outcomes and evidence provided by research will be critical in ensuring that we are able to develop the capacity to meet this need at both population and individual levels. Whilst there is an increasing need for palliative care, unfortunately, people's awareness and understanding of palliative care and its benefits can be something of a grey area. The Institute's recent survey of 500 people in Northern Ireland, commissioned for this year's Palliative Care Week, looked at the public's perceptions of palliative care. Encouragingly, 80% of respondents agree that when they hear the term palliative care, they think that it is about supporting the quality of life for those with life-limiting conditions. However, it also highlighted some of the misconceptions that remain about palliative care, including that it is only about end of life. Despite the excellent work the Institute has done to raise awareness and understanding about palliative care and its benefits, 4 out of 5 people in Northern Ireland think about end of life when they hear the term palliative care. The Regional Palliative Care Partnership Programme has been key to drive innovation and vision and dedication of its research team and member organisations. Together, they have promoted and enabled the transformation of palliative care services in Northern Ireland. The All-Ireland Institute has played an important role in the partnership through Voices for Care and also bringing valued learning and insights from palliative care colleagues and counterparts across the island. Whilst we do not have a programme for government or budget in place in Northern Ireland, the Department of Health remains focused on progressing a number of initiatives to further improve palliative and end-of-life care and bereavement support. These include the Department's cancer strategy, the development of advanced care planning policy for adults launched back in October, and the work of the Regional Bereavement Network to enhance bereavement support, and work to be taken forward to consider the provision of specialist palliative care for adults. Looking forward, if we are to meet the challenges of an ageing population and the increasing demand for palliative care, the role of high quality and clinically relevant research will be pivotal to informing better policy and services. The network's new strategic plan for 2023 to 27, which is being launched today, includes a series of priorities and commitments that are focused on improving the quality of life and death for people with life-limiting conditions through palliative care research. The plan sets out a range of practical ways in which high-quality collaborative research can be supported and how this directly links to policy, practice and, importantly, to people. It also recognises the need for meaningful engagement and partnership. I applaud the desire and drive amongst the palliative care community across the island of Ireland to build upon the collaboration that is at the heart of today's symposium. Your research, evidence, learning and sharing of experience will directly improve the quality of life for those with life-limiting illnesses. Thank you for the opportunity to be part of today and I hope you enjoy your day.
Thank you.